Thank you for coming to this press conference. Lawrence is dialing in from New York, from Washington, because he's there for a meeting. And
it's New York.
New York. So now it's in New York. So it's morning at 5:30, I assume. And later on, he will also say a few words after the ministers. Good afternoon to all of you. About 3 weeks ago, we eased our safe management measures and transited our border measures to a vaccinated travel framework. Even with this easing, infections have continued to decrease. Over the past week, the average number of daily cases has been about 3,100. As of yesterday, our week-on-week ratio was about 0.9. This suggests that the cases have more or less stabilized. The number of cases in the ICU or requiring oxygen supplementation has also remained low. This gives us the confidence to resume even more economic and social activities. From 26th April, we will further relax our SMMs based on the 5 key parameters we had earlier outlined. Just to recap, these are group sizes, mask wearing, workplace practice requirements, safe distancing, and capacity limits. Other than specific high-risk settings, we will lift the limits across all 5 parameters, except for mask wearing, which will remain optional outdoors and continue to be required indoors. Minister Wong will elaborate further. Under the current vaccinated travel framework, fully vaccinated travelers entering Singapore already do not need to serve a stay-home notice or take a on-arrival test, or OAT. Those arriving via land checkpoints also do not require to take a pre-departure test, or PDT. Because the framework ensures that travelers are fully vaccinated with effective vaccines, imported cases continue to account for a very small proportion of our total daily cases, around 5% or less. And the vast majority of the imported cases also experience only mild symptoms and are able to recover uneventfully at their place of residence. Hence, we will adjust travel arrangements further. From 26 April, we will remove the PDT requirement, a pre-departure test requirement, for fully vaccinated travelers arriving via air or sea checkpoints. This means that fully vaccinated travelers will no longer need to take any test to enter Singapore. When we resumed travel by private transport across the Singapore and Malaysia land borders at the beginning of this month, we had said that we would progressively allow more transport modes. Therefore, from 1st May, we will reinstate cross-border public bus services between Singapore and Johor Bahru. Cross-border taxi services will also be reinstated. Further details can be found in LTA's press release. We had raised our DOSCON level to orange in February 2020 due to a rise in unlinked local cases at that time, and we expected significant disruption to daily routine, given our focus on isolation to contain transmission. Today, the situation has changed. Even though the virus is more prevalent, most infections are mild as a result of our high vaccination coverage. Our simplified healthcare protocols and SMMs are expected to cause minimal disruptions to our lives. Therefore, the time is right for us to step down our DOSCON level to yellow. This will take effect from 26th April. Under DOSCON yellow, each of us must continue to comply with the SMMs and exercise social responsibility. This means that if we are unwell, we should really stay home. We must also maintain good personal hygiene and adhere to health advisories. I would like to take this opportunity to thank everyone for your patience, trust, and support in our journey towards living with COVID-19. Today's announcement marks a significant milestone in our journey. I would like to encourage everyone to remain vigilant, as the situation can change quickly. The government will also continue to monitor both the local and global situation closely so that we can respond quickly to any development. Let us keep at our efforts and continue to to progress towards a COVID-resilient nation. Thank you. I hand over to Minister Ong.
Thank you, Kim Yong. After 2 over years, today is really a happy day and marks a very important milestone. I just want to echo Minister Gan's words that it's a major milestone, and being able to announce a reduction of our pandemic status from orange to yellow. We know the danger is of course not over, but we can all breathe easier now. And I just want to say this is really a result of all our hard work, all our perseverance, all our collective effort. And I want to especially thank all our healthcare personnel and workers, everyone at the front line, all our operational staff, all hold up mostly in Harbourfront, dealing with case management, testing, vaccination planning, health protocols, etc. And all your contribution and sacrifices lead to the milestone today. And you are the frontline workers, the back-end heroes, also the last line of defense, and you made today possible. Thank you very much. Let me just briefly talk about the current pandemic situation. There are 3 statements really. Number 1, the pandemic situation remains stable. This is despite our decisive move on 29th March this year to open up borders and ease up on our SMMs. Notwithstanding that move, daily cases have been trending down over the past 3 weeks and have stabilized about 3,000 per day. It reflects the fact that our society is now a lot more resilient to the COVID-19 virus. Second is the situation in our hospitals. It is steadily improving, and DMS will elaborate further. I have earlier described a pandemic with rising cases like riding a bicycle downhill. It just goes faster and faster, and we need to apply the brakes until we land at the safety zone. I think we have landed in a safety flat ground now, but keep on pedaling. If not, the bicycle will stop and you will still fall. But we are now in a good position, flat ground, stable, steadily improving. Third thing is, notwithstanding all this improvement and that our bicycle is on the flat ground, we still need to be alert to risk over the horizon. What are these risks? One immediate one facing some countries is a resurgence of the Omicron infection wave. And this has started to happen in some parts of the US, for example, and this is driven by the Omicron BA.2 strain. However, this is less of a concern for us, given that the Omicron wave that we went through is already driven by BA.2 variant. A potential risk months down the road is when the protection conferred by vaccines and infections start to wane in our population, and then a new wave may emerge. And today, we have not seen new waves driven by a similar strain as earlier waves in other countries. But we should expect this to happen, even if they are not as large or severe as the previous wave that just passed. It's something that we must be alert to, because protection will wane, a new wave will start at some point. But it should not be as big as the previous one. The last and the most worrying risk, of course, is the emergence of a new VOC, or variant of concern. And this continues to be a potential curveball that may knock us back to square one, and we must be alert to that. These risks remind us not to be complacent and to be alert to possible future dangers. But on the whole, things continue to look up for us. Our social resilience is strong, and now we are in a comfortable position. We can therefore afford to take further steps to restore pre-COVID-19 normalcy. However, given the risk over the horizon, we should not declare a Freedom Day until the pandemic is truly over. Instead, we will step down but not dismantle our measures completely. By keeping certain levels of precaution, we remind ourselves that the pandemic is not over, and we retain the ability to reactivate selected measures if and when the situation requires them. So we should expect this new posture announced today to last for some time, perhaps several months, so long as our situation remains stable. Minister Lawrence Wong will elaborate on the SMM aspects of the posture. I will talk about three things: VDS, safe entry, four things: VDS, safe entry, trace together, and the second booster shots. Let me start with VDS, which is vaccination differentiated SMMs. I have explained the need to retain VDS in Parliament recently, earlier this month. The key consideration is still this, that individuals who are not fully vaccinated account for a disproportionate number of patients who fall severely ill or die. So when our hospitals were still under a lot of pressure, VDS is critical in ensuring that we do not assert too much burden on our healthcare system. However, now that the hospital's workload has eased considerably, there is less need now to retain VDS in its current form. We will therefore step down, but not dismantle VDS, by reducing the settings that require it. In particular, settings such as places of worship, malls, retail shops, supermarkets, etc., will no longer need to maintain VDS. It also means that the onus now falls on the individuals who are not fully vaccinated to take the necessary precautions to avoid crowded places so that you minimize your chance of being infected and falling severely ill. We will, as I mentioned, not remove VDS completely. It will continue to apply to the following higher risk settings. 1, night spots with dancing, because this is a unique setting where lots of people gather with prolonged and close interactions with one another. 2 are the larger events with at least 500 participants at any one time. Some examples are the larger scale gala dinners, weddings, D&D, conference dinners, for example, because these are potential super spreading events. 3 are the F&B outlets, namely restaurants, hawker centers, and coffee shops, because these are mask-off settings frequented by many members of public on a permanent basis, and including members of public who may be vulnerable. I want to specifically address the issue of workplaces, where we have in place a policy called WVM, or called Workforce Vaccination Measures. WVM requires an employer to ensure that employees who return to the workplace need to be fully vaccinated. With the stepping down of VDS across most settings, we will also step down the WVM policy. Nevertheless, MON has been discussing with the tripartite partners who agree that given the significant pandemic risks that still exist in the coming months, businesses should be given the flexibility to impose vaccination-related instructions for employees for business continuity and workplace health and safety reasons, even though this is no longer a national requirement. The tripartite partners will therefore be updating their guidelines on the implementation of vaccination-related instructions for businesses or for their employees to provide them with this flexibility to impose measures based on their specific business considerations. MOM will be providing more details. Second aspect I want to talk about, safe entry. As we stand down VDS for various settings, such as malls, supermarkets, places of worship, I mentioned earlier, venue owners can deactivate their safe entry operations. However, where VDS still applies, namely what I mentioned earlier, certain night spots and larger events with more than 500 people at any one time, safe entry check-in will still be required to verify the vaccination and test status of the participants. And this is operationally familiar to event organizers and venue operators and will be convenient to implement. As for restaurants, coffee shops, and hawker centers, VDS applies, but we will instead rely on random checks on individuals by service staff and enforcement officers. This is already the practice for hawker centers and coffee shops today, but we will now extend the arrangement to restaurants. That means mandated SE entry check-ins can be removed at all F&B establishments. The onus is on the patrons and customers to ensure that they are fully vaccinated before dining in a F&B establishment. So overall, given this posture, we will see significant reduction in safe entry check-in points all across the island, and in most places we visit on a day-to-day basis. And this will reduce cost of operation and is another key psychological step towards resuming pre-COVID-19 normalcy. Third aspect I want to talk about is Trace Together, TT. TT is both an app as well as a token. Some people carry it as a token. And TT serves two purposes. One purpose is as a contact tracing tool for specific settings. As the epidemic situation has improved, MOH has discussed with relevant agencies who agreed to step down contact tracing and instead control outbreaks. Focus on controlling outbreaks. We will also cease the issuance of HRN or health risk notices nationally. MOH would instead like to remind everyone, continue to practice personal and collective responsibility by informing close contacts if you are infected with COVID-19, and the close contacts in turn should follow Protocol 3, test yourself to be negative before leaving your homes. And therefore, from 26 April 2022, we will step down the use of TT as a contact tracing tool. This means we will no longer require infected individuals to upload TT app data or to collect their TT tokens to upload the data. We'll no longer do that. The TT token and the app, we'll no longer do that to upload the data. However, there is still a need to remain vigilant and to maintain a state of readiness. So please keep your TT app in your smartphone and retain your token in case there's a need to reactivate TT and safe entry again. And if you keep your TT token or keep your app in your smartphone, they have been pre-programmed and they may still collect data of your contacts in the background. But the data will only stay in your token or in your smartphone, and they will be purged in 25 days. The other purpose of TT is to use in conjunction with safe entry to verify your vaccination status when you check into a venue that requires VDS. And this is another reason to keep the TT app in your smartphone and retain your TT token in case you want to go to a nightclub or you go to a gala dinner or a wedding where VDS applies. However, we will restrict this application now to purely verifying your vaccination status. All safe entry data to a premise or event will not be retained and they will be purged within a day. I want to clarify that as in the current situation, and as explained in Parliament last year, any data that is generated by the TT app and token may be used by police officers and law enforcement officers for criminal investigations and proceedings in respect of serious offences. And this is in line with the COVID-19 Temporary Measures Act. If a serious criminal offence has been committed, the police must be able to use this data to bring the perpetrators to justice, seek redress for victims, and protect society at large. Finally, let me talk about the second booster shot. As we expect COVID-19 to become endemic and stay with us, The general consensus among scientists around the world is that further booster shots will be necessary sooner or later. MOH and our expert committee, the EC19V, agree with that view. This is not different from individuals having to take your annual vaccinations for influenza, which is an endemic disease. The question is when second boosters should be administered, and then what vaccines to use. So on the issue of timing, international practices vary. The US, Israel, they are pushing ahead, while the EU is planning to administer second booster later in the year, in anticipation of a winter wave towards the end of the year. We can think of a second booster like buying insurance protection. You buy travel insurance before you travel. You buy car insurance before you rent a car and drive. Booster shots, likewise, need to preempt the outbreak of a new wave of infections. Administer too early, and chances are it will be wasted. Administer too late, and damage would have already been done. You've got to catch the timing right. To determine a suitable time to proactively administer a further booster, MOH is closely monitoring two indicators. One, whether subsequent Omicron or new variant waves break out in other countries. When they do, we will then have a good idea when a new wave may emerge in Singapore, and then we roll out a second booster before that happens. Second indicator we look at is the level of vaccine protection against severe illness in our population who had already had their first booster. And so far, this has been holding up well as vaccine efficacy against severe illness across different age groups continue to stay very high, well above 80%. Many scientists think that this can hold out for as long as 1 to 2 years, maybe even longer. And we will watch out for early signs of waning of vaccine efficacy against severe illness, which will indicate the need for a second booster. As of now, MOH is recommending further booster shots for seniors aged 80 and above, those living in aged care facilities, and individuals who are medically vulnerable. And today, within 2 weeks of our recommendation, 17,200 seniors have taken or booked their second booster. And this is about 30% of those eligible. And many more in this age group will become eligible in the months ahead. And this is, to us, very encouraging as it shows that people are getting used to the idea of taking a booster and protecting themselves. For individuals aged 60 to 79, we do not yet recommend that they take the second booster. But our vaccination centers will offer it to them if they want to take it, starting from 150 days or about 5 months after their last booster. So in short, we recommend second booster to individuals aged 80 and above, and we offer a second booster to those aged 60 to 79. For these two groups, the second booster will continue to be free of charge and available at all our vaccination centers. Another key question is then which vaccines to use when we want to proactively roll out a second booster for the general population. And this will depend on the nature of the new variant of concern. If it is a derivative of the Omicron variant with similar characteristic, and there will be a high chance that the current vaccines will continue to confer good protection and will serve us well as a second booster. However, if the new variant of concern is more dangerous than the Omicron variant, then it may require a different response strategy as far as second booster is concerned. So to judge whether a variant is more dangerous, we look at two characteristics. One, does it lead to severe illnesses and deaths does it lead to more severe illnesses and deaths amongst individuals who are infected? If it does, we then may have to respond differently by bringing back contact tracing, isolation, quarantine testing. However, such a variant may circulate in the community, but if it doesn't dominate over Omicron, it will die off over time. It will be short-lived. And this brings us to the next characteristic, which is, will a new variant of concern be more infectious than Omicron and dominate over it? So it is entirely possible that we have a variant of concern in future that's more deadly than Omicron and also more transmissible. And if it is both, we will then face a worst-case scenario. We may then need to hunker down for 6 months or more while scientists develop a new variant-specific vaccine. And this is one of the worst-case scenarios that we need to be psychologically prepared for. MOH will continue to work with our international counterparts to closely monitor the emergence of new variants of concern. I will now pass the floor to DMS Professor Kenneth Mark. Thank you.
Thank you very much, Minister. Minister has shared how the COVID-19 epidemic situation has eased over the last month. Our daily case numbers has trended down since early April, and they have stabilized at the present level of about 3,000 cases per day. In fact, on the 21st of April, there were a total of 3,120 new cases reported, of which just under 200 of them needed admission to any of our healthcare facilities for monitoring and for care. The remaining, which is the vast majority of our cases, was able to rest and recover at home, either under the Home Recovery Program or what we call the P2PC program, the Primary Care Directed P2 program. Overall, we had under 13,000 cases which were recovering from COVID-19 infection, but only 979 cases in our healthcare facilities. These numbers continue to trend downwards as the overall incidence of community infections drops. About 2% of our patients presently are admitted in hospital, and with another 2% in our community treatment facilities or CTFs. We retain sufficient bed capacity for our present and projected needs in both our hospitals and the CTFs. As of yesterday, we had 5 COVID cases admitted in our ICU for critical care of the COVID-19 illness. Our adult isolation bed occupancy was less than 37%, and in our hospitals, we have started to repurpose beds that were previously dedicated for COVID-19 use and have allowed our hospitals to use them now to accommodate non-COVID-19 patients. And similarly, we will continue to monitor the demand for CTF beds and will rationalize the number of CTFs that we have operationally ready while maintaining plans to activate further CTF capacity as needed. The hospitals have started allowing their staff to take leave while taking care to ensure that essential services continues unabated. And this morning I met with the medical directors and the chairmen of the medical boards of all our public hospitals to discuss the work that we have to do at this time as the community COVID-19 situation stabilizes. We endeavor to provide our healthcare staff with the opportunity to rest after months of hard work, but we will also be bringing more non-COVID-19 patients back into the hospitals for elective clinical treatments and for reviews in the specialist outpatient clinics. The hospitals will be prioritizing this business as usual work on the basis of the severity of their patient's medical condition and the need for more urgent or time-sensitive treatments. And as there may be still a backlog of cases that need treatment, I seek the understanding of the public if they still encounter some waiting before they may return to see their doctor in person in the hospitals. In keeping with the announcements made today on the easing of VDS measures in all community settings with some limited exceptions, MOH has also reviewed the visitor policies for our hospitals and nursing homes. And from the 26th of April, we will also be revising the visitor policy for fully vaccinated, to visit fully vaccinated patients admitted to our healthcare institutions. However, the hospitals may still impose local measures, including the pre-registration of visitors or to restrict the number of visitors per patient at the bedside at any one point in time. And this is to prevent crowding from occurring within the wards or in the clinical care areas. This also reduces the risk that immunocompromised and unvaccinated patients have for being exposed to COVID-19 infection. the local hospital rules will continue to apply, for example, in allowing visits to take place within defined visiting hours, so as to ensure that the ward staff are not distracted from delivering their care to their patients at other times. The hospitals will retain the flexibility to provide exemptions to these rules on an exceptional basis, based on clinical need, for example, for patients who are critically ill in the ICU or for caregiving training purposes. All visitors will be encouraged to continue with self-ART testing before their visit, and visitors who are unwell should be socially responsible and refrain from visiting, irrespective of their ART test result. We will similarly ease our visitor policies for aged care homes, and further details will be provided by the Ministry of Health and the nursing homes later. Although we are in a better position now than 6 months ago, when we were dealing with the Delta and subsequent Omicron wave, we should not be complacent and should remain prepared for the possibility of more waves of infections and outbreaks arising, perhaps from a new and emerging variant of concern. And even though we have relaxed many of our safe management measures in the community and the workplace, it is important for us to continue exercising personal responsibility to keep the COVID-19 outbreak under control. And this includes monitoring our health, and if we have respiratory symptoms, fever, a loss of taste and smell, we should continue to practice self-isolation to prevent any potential spread to others and to test ourselves with an ART test kit. And if you have been in close contact with a COVID-19 case, you must be vigilant and test yourself to make sure you have not been infected following Protocol 3. And if you turn positive in your ART test, you should then follow Protocol 2 or consult a doctor if you have higher risk factors for severe infection. The second responsibility that we have to ensure that we should ensure we are appropriately protected against COVID-19 by making sure that we are up to date with our vaccinations. MOH and EC19V, the expert committee for COVID-19 vaccines, has been reviewing the data concerning the immune protection that's provided through vaccination and the degree of natural immunity that's accorded through recovery from infection. And this will guide our recommendations under the National Vaccination Program. Primary vaccination with COVID-19 vaccines of proven efficacy, augmented by booster vaccines where relevant, does provide a robust immune protection against severe infection, hospitalization, and death. Our local data shows that vaccine effectiveness against severe disease, or VES, remains high for some time after completing both the primary course and a booster dose. In our local studies, the VES for people above the age of 60 years remains well above 80%, and in some stages reaches 90% at the 120 to 180 day mark after booster vaccination. The VES is also high following the booster dose for hospitalization. And this affirms the importance then of having up-to-date vaccinations to reduce the risk of getting severe infections and dying from COVID-19. However, some waning of effectiveness against severe disease does take place over time in the population of seniors who have received their booster vaccination. And the data from other countries with more mature vaccination programs, like Israel, has demonstrated that additional protection against severe infection may be obtained in this population of seniors and those who are medically vulnerable through the administration of an additional vaccination dose. And this represents the second booster dose or the fourth vaccination dose for those who have undergone a 2-dose primary vaccination course. And in particular, the overseas data shows the greatest benefit to decreasing severe disease risk to be in persons above the age of 80, following the second booster vaccination dose. This is the basis for the recommendations from the expert committee, which have been fully accepted by MOH, to recommend the second booster dose for seniors above the age of 80, or who have medical vulnerabilities, or who live in aged care settings. The vaccination effectiveness data also shows some benefit from a second booster dose in those between the ages of 70 to 79, and to a slightly lesser extent in those between 60 to 69 years of age. But it's not to the same great extent as in those in the older age group above 80. And this is because the incidence of severe infection in these age groups is lower compared to those above 80. So after further consideration and discussion with EC19V, MOH has not yet recommended for all individuals aged between 60 to 79 years to undergo vaccination, but we are allowing our vaccination centers to offer that second booster dose to those in these age groups if they want to take it, starting from 150 days after their last booster vaccination dose. And this timing is based on our local data, which shows that waning of vaccination protection takes place after that 150 days. And for these groups, as Minister has mentioned, the booster dose will continue to be provided free of charge at any of our national vaccination centers. In younger age groups, for example, between the ages of 12 to 60 years, our data suggests that the second booster dose is not as beneficial at this time. The risk for getting and the incidence of getting severe infection is much lower, unless associated with the presence of chronic medical conditions which renders that individual vulnerable. And so augmentation in VES for the second booster dose in these younger age groups is much less compared to that in the older age groups, or for the first dose. There's some overall boosting against all infections seen, but this effect wanes very rapidly after a short period of about 2 months. So if we need to provide the second booster dose for the younger population, this is more appropriate as a strategy to augment immune protection at a time when we are experiencing a new wave of a highly transmissible or highly virulent novel VOC, rather than at a time when the situation is improving and the community caseload has stabilized. We are therefore not making any recommendations at this time for a second booster dose to be given to those who are less than 60 years, but we will review the need to expand our booster vaccination program if the public health situation changes. EC19V will also review whether there's a need for more targeted booster vaccinations in subpopulations where their immune protection provided from earlier primary vaccinations is still not optimal. We are in the midst of reviewing the data from vaccinating children below the age of 18. We have previously made adjustments in the vaccination dose schedule within the primary vaccination course for children between 5 and 11 years, for example, so as to enhance the safety of vaccination regimes. But dose reduction may lead to differences in VES when compared to using adult doses in the older population. So we need to carefully study the data to determine whether the recommendations need to be made to offer booster vaccinations for children. And MOH will make future announcements on this when our review is completed. With regard to recovered persons, EC19V has recommended that persons aged 12 and above who have completed their primary vaccination series and have recovered from COVID-19 infection should also receive booster vaccination doses. This booster vaccination dose may be received from about 28 days after the infection and should not be delayed beyond 9 months after completing their primary vaccination course. This recommendation takes into account recent evidence that the immune protection in recovered people who have previously been infected can vary very significantly between individuals, and it similarly wanes over time. And it means, therefore, that we cannot assume that a recovered individual will have enhanced immune protection after their recovery from an infection compared to a non-infected individual at a comparable time point following their vaccination. Both our local and international experience has shown that booster vaccination is safe for recovered persons, and it will help to maintain a high level of protection in them against severe infection. And hence, all persons aged 12 years and above and who have completed their primary vaccination series are now recommended to receive their booster vaccination dose, irrespective of whether they had previously recovered from COVID-19 infection. The third strategy to keep us resilient in DORSCON yellow is to maintain our vigilance to monitor community COVID-19 situations, as well as to monitor for the emergence of new variants of concern, which may be associated with a higher transmissibility and lead to more spread in the community or greater virulence. To this end, MOH will work with our stakeholders and partners locally to maintain our epidemic surveillance framework. And this provides us with a continued means to monitor the community incidence of COVID-19 and to identify transmission patterns which guides our public health actions. The surveillance will continue to include case-based testing surveillance testing of patients who present with acute respiratory symptoms to our network of primary care clinics. We will continue to track hospitalization and ICU admissions. We will use wastewater testing, and we will carry out genomic and sequencing testing of community and severe COVID-19 cases so as to better track the distribution of circulating COVID-19 variants in Singapore. We will be working with our international partners to monitor the developments outside Singapore, particularly with regard to emerging variants of interest and concern in those other countries. And although we've lightened our testing approach for travellers, testing and sequence testing of imported cases will continue to allow us to track the introduction of new variants through travellers. We have the capacity and remain ready to step up when needed to enhance testing and surveillance when a new threat emerges. But overall, keeping our personal discipline and vigilance, not being complacent, maintaining our personal protection through up-to-date vaccinations, retaining our ability to monitor and test for variants, and to surge our capacity to test, treat, and vaccinate when needed are the key components needed to enhance our resilience nationally against COVID-19. Thank you.
Lawrence, over to you.
Good evening. Good evening, good morning from me in New York. I'd just like to elaborate on the SMMs, which Minister Gan highlighted. We are making a further significant move to ease these SMMs along the 5 key parameters which you are familiar with, and these will take effect from the 26th of April. First, group sizes. This is currently now at 10 persons. We will remove group size limits for mask-off activities. That means there are no longer limits on group sizes, and consequently, it means if you are playing sports, there will be no group size limits. If you are visiting friends or family members, there will also be no longer limits on the number of unique visitors. Second, safe distancing. In line with the removal of group size limits, safe distancing will no longer be required between individuals or between groups. Third, capacity limits for larger events. It's currently at 75%. We will raise this to 100%. So we will effectively be removing the capacity limit for larger events and settings. The one exception would apply to nightlife businesses where there is dancing amongst patrons. Because of the higher risk of this activity, this will continue to be subject to a 75% capacity limit for now. Fourth, workplace requirements. Everyone can return to the workplace, so it will be an increase from the current limit of 75% of those who can work from home. Basically, back to pre-COVID, everyone can return to work. But while work from home may not be needed as a public health requirement, we continue to encourage all employers to retain and to promote flexible work arrangements and some form of practical work from home arrangements for their employees. Finally, mask wearing. This will largely remain as it is, and we have said before that mask wearing is effective and it will be one of the last few measures that we will do away with. So mask wearing will largely remain the same, which means outdoors it's optional, but mask wearing continues indoors. But we will make some adjustments to the mask wearing requirements for workplaces. In particular, now that we are allowing everyone to go back to work, we will adjust the mask on requirement in the indoor setting for workplaces such that workers will be allowed to remove their mask at the workplace under 2 conditions. 1, they are not physically interacting with one another, and 2, they are not in customer-facing areas where interaction is likely to happen. So if you are just back to office in your workstation working, then we will allow you to take off your mask, because it will be very hard to be back at work throughout the day and then wearing a mask and working. And therefore, this flexibility is extended for such an occasion, but we would continue to encourage everyone to exercise responsibility. And if you take off your mask when you're working, ensure that you're maintaining a safe distance from your colleagues, and obviously do not gather together in a crowded setting. right? As I said just now, this would apply under those two conditions, which is that you are not interacting physically with one another and you are not in a customer-facing area where interaction is likely to happen. So these are the key moves around the SMMs 1 to 5. All in all, it's a very significant step forward in our journey to live with COVID. It has been more than 2 years since we raised the alert to DORSCON Orange in February 2020. And since then, we've gone through a lot together. Remember when we first did this more than 2 years ago, we had to deal with panic buying. We've gone through circuit breaker. We've gone through heightened alerts. We've gone through many rounds of restrictions. 2 years isn't that long, but it somehow feels like a lifetime ago because so much has happened and we have been through so much together. And working together, we have been able to keep everyone in Singapore safe, to protect lives and livelihoods, and to achieve one of the lowest COVID-19 fatality rates in the world. I echo my colleagues in saying that we couldn't have done all this without the contributions of each and every person in Singapore, especially, of course, our healthcare and frontline officers, as well as many unsung heroes across all walks of life. But indeed, everyone has played a part in this effort. And so we thank you all for your contributions and your support. With these changes, we can now have a well-deserved breather after 2 very difficult years of fighting the virus. But let's always remember, we are getting closer to the finish line, but the race is not over, and the pandemic is certainly not over. A new variant will emerge sooner or later, as you heard just now from Minister Ong and DMS. No one can predict what this next variant will be, and if need be, we may very well have to tighten our restrictions or reinstate trace together and safe entry. So as Minister Ong said just now, our mantra or the approach that we are taking is step down but not dismantle. We must keep our systems warm so that we can activate them later on if the need arises. And we hope everyone understands this so that if and when we need to tighten, you will be mentally and psychologically prepared for such future scenarios. But for now, let's all cherish the hard-earned relaxations and resume more normal lives. Let's continue to exercise personal and social responsibility, keep faith with one another, and see through this pandemic together. Thank you.
Thank you. Now I'll open the floor for questions from the journalists.
Thank you, Ministers and DMS, for the very detailed remarks. We will now begin with the Q&A segment. So members of the media, please remember to use the raise hand function on Zoom if you would like to ask a question. A gentle reminder to speak slowly and into your mic when asking your question. As we have a limited time for the Q&A, do keep to one question only. For the first question, could we have it from Estes Timothy?
Hi, thank you, Ministers and DMS. Now, throughout the pandemic, the DORSCON level seems to have not been very useful. We've gone through a whole range of restrictions, including those in the red level, despite never changing DORSCON from orange. Will the DORSCON framework be reviewed following this step down to make it more relevant before the next disease hits us? Thank you.
Thank you. I think MOH is overseeing the DORSCON framework. I'll ask Minister Ong to elaborate on this, or DMS. But I should just say that it may not be apparent to the members of the public, but DORSCON levels are very important from the point of view of the preparedness of the government agencies, including the healthcare institutions. When we raise the alert status, some of the actions have to be taken, including putting aside beds to be ready for COVID-19 cases, raising the alert level of the agencies, putting in place the emergency response teams within the various agencies. And these actions are not sustainable for over the long period of time. We have sustained it for 2 years, And in order for us to allow some of these agencies to get back to their normal mission, to be able to run their normal operations on a more sustainable basis, we will need to, therefore, to adjust the DOSCON level to allow them to step down their alert status so that it's more sustainable. I'll ask Minister Ong to talk about the review, if there is.
Thank you. Kim Yong arrowed me to give the answer as health minister, but actually the former health minister knows the system best, and he has given a comprehensive answer. I just want to add that in a way I'm happy that, Timothy, you asked that question, because it does mean that over time we understand the DOSCON level better. Remember those times where it changes color and there's a run on the supermarket, whereas after 2 years, we are not just looking at the headline color, but looking at the prevailing measures. What are the SMMs that we are implementing, border restrictions? Those measures and healthcare protocols, those measures matter much more in terms of a response. But as of now, as an overall umbrella scheme and framework, I think it still serves its purpose. We'll constantly review all our SMMs as well as the framework, so we move with the times and have a system that suits the circumstances.
Thank you, Ministers, for the reply. For the next question, we will take it from Taopao's Chiping.
Hi, good evening, Ministers and DMS. This is Zhipeng from Taobao. Since our main focus has now shifted to the severe cases which require oxygen and ICU care, and the daily case count no longer matter as much, would MTF consider to stop reporting the daily infection numbers every night? Thank you.
Zhipeng, thank you. We actually already stopped issuing press release every night, but from a WHO global pandemic monitoring and surveillance point of view, we still need to play our part in the international community and make our data available. And other countries do check our websites and check out our numbers. So this is a practice that will continue. But I do not rule out at some point WHO may come together with its member states, come together and decide that maybe we shift the system from the pandemic surveillance point of view to monitoring severe cases. And this is something that we will engage in discussion with the WHO on.
In fact, in the interest of transparency, and that is why we continue to put it on the website, we upload the data, and also to be in line with global practices. But I would encourage the media to reorientate the focus onto the more serious cases and to report when there's exceptions, rather than to report the headline number every day. It is on the website for record, and for those who are interested, can always go to the MOH website to get the number.
But just add one point, which is while the day-to-day numbers really, you're right, that matters much less, the shape of the curve still matters. Because if you look at the shape of the curve now, you know that we are come down to a stable level, and at some point it may rise again here or in other countries. So it is still useful from that perspective.
Thank you, Ministers. May we have the next question from CNA's Sherlyn?
Hi, Ministers and DMS. This is Sherlyn from CNA. My question is regarding the boosters. Earlier on, it was mentioned that for 60 to 79-year-olds, it will be offered but not recommended. So how are they supposed to decide whether they should get the vaccination or not? And is there any room of bringing in other brands of vaccines soon as well, like Novavax? Thank you.
Thank you very much, Sherlyn, for the question. We recommend that individuals who might be interested in getting a booster dose, but who don't fall within the scope of the EC19 and MOH recommendations, to have a conversation with their doctor. And the doctor will be able to assess what the individual risk status is. It may very well be that a person is less than 70 years of age, but has risk factors that render that individual medically vulnerable. And indeed, such an individual would still be eligible for the booster vaccinations based on our recommendations. But for everyone else, this is a risk-based discussion and conversation. If that particular individual still wishes to get vaccinated, that can be provided within the private vaccination program or the private vaccination clinics, but it would not be offered within the national vaccination program, nor would it be part of the recommendations. So if such an individual does do so, that would be done at cost. It would not be provided free of charge. And if there were adverse effects that arise from a vaccination that was actually undertaken by choice, then this would not be eligible for vaccine financial assistance support under the National VIFAP program. With regard to other vaccine choices, the vaccines that are currently available include the mRNA vaccines as well as Sinovac. The Sinopharm vaccine was provided under the special access route and allowed by HSA. We have, in principle, also approved the Novavax vaccine. We are currently still negotiating with the manufacturer for delivery into Singapore. I understand that, in fact, a vaccine batch that is designated for our purpose is currently undergoing batch testing. And we are hopeful that very soon that batch may be delivered to Singapore. And once details are confirmed, we will be able to make some announcements on this.
Thank you, DMS. May we have the next question from Channel 8's polling?
Hi, Ministers and DMS, polling from Channel 8 News here. Before I ask my question, can we request for Chinese soundbite on the rationale on the further easing of community measures? Then my question is the government considering allowing commuters to mask off on public transport, particularly on feeder buses, since commuters don't usually spend much time on such services? Thank you.
The simple answer on the masking on feeder buses is we don't think it's appropriate. Because if we say the bus ride is shorter and therefore you take out your mask, then what about other indoor settings where you go in for 10 minutes and you get out? So once you go into that kind of granularity of the rules, it becomes unclear. People can become confused. So I think it's better for us to say once you are indoors, especially when it's crowded, please do keep your mask on. As for Chinese soundbite, you want to talk about the rationale, OK。现在的情况大概有3点。第一点呢，就是我们的疫情的情况已经稳定了。虽然在3月29号我们放松了安全措施，但是病例没有增加，反而病例逐渐的减少，现在已经缓和到每日大概3000个病例的一个局面，所以已经缓和下来，稳定下来。第二就是我们的医院呢，情况也是不断的在好转，现在医院的压力不像几个星期前那么大了。但虽然如此，情况虽然好转了，我以前就形容过，一个一波就好像搭脚踏车下坡的情况一样。它的脚车会越来越快，但是我们要抓紧我们的刹车器，把脚车缓和下来，让我们安全的达到平面。现在的情况呢，就是我们已经安全的达到平面了，但是要继续的踩脚车，不踩的话，脚车一停下来就会倒下来了。为什么会继续要踩呢？是因为眼前接下去几个月还是会有风险，可能会有新的一波，可能会有新的毒株，我们这些都是风险，我们要注意到。所以我们现在的政策呢，就是我们可以安全措施放松、降低，但是不能取消。这整个概念就是这样。所以黄训才部长刚才所宣布的 SMM 1到5，我们可以逐渐的把它放松，其实只剩下一个条律，就是室内戴口罩。其他的条律呢，已经增加到100%，或者是人数聚集的人数也没有限制了。所以这5个条律还在，但是我们5个条律的管理方法，4个条律现在已经没有实际的效应。但是5个条例还在，随时需要的时候，我们还可以把它调整，抓紧我们的社会安全措施。这就是大概的概念。很重要的就是，我们可以放松，我们可以降低， 但是不能够取消安全管理措施。
Thank you, Minister. We will now be taking the second last question from AFP's Catherine.
Hi, thank you, ministers. Can I please ask why migrant workers still need to apply for exit passes for community visits while most restrictions are being eased for the rest of us? And do you have a
Thank you for your question. Ministers, would you like to respond to that first question?
I couldn't hear the rest of the question. I don't know if you all heard it. on
No,
your side.
no, we can't also. Maybe just ask her to repeat the second half.
Could you repeat your question? Please stick to one question.
The second part was, do you have a timeline for lifting restrictions on dormitories? Thank you.
Well, let me answer that. Yeah, we have already significantly eased the measures for migrant workers in the dormitories and also allowed more of them to go into the community. But as we all recognize, there are greater risks in these settings because of the communal living nature of dormitories, where they are all eating, living, dining together. So the risks are greater. We want to ensure that they are well protected. And therefore, some measures are still in place, some control measures, but clearly we are moving in the same direction of easing the measures for migrant workers and in the dormitories, and we will allow eventually all of them to go out to the community. There should be no doubt about that.
Thank you, Minister. We will now take the last question from Nikkei's Takashi.
Hi, what do you think is the reason for the number of new cases has not increased much after the drastic easing of restriction at the end of March? Is it because the Singaporeans have acquired a strong immunity? And do you think it is unlikely that the number of new cases will increase significantly after this time's deregulation?
I think in short, this is a force of nature. There are certain things that humans can do and policies can do to influence the shape of the pandemic, but ultimately the virus is a force of nature and it's a mind of its own. But having said that, I would say, why did cases remain low despite our opening on the 29th of March? I think number one is high vaccination rates, and we have one of the highest in the world, 92% of all whole population. Second, there are quite a number of people who have been infected. That's also raised our collective resilience. Third is the way we have cooperated as a society, abiding by the rules, abiding by safety precautions, and all the measures that we have done in whether it's trace together, safe entry, and self-observing protocol 3, for example, and all this help slow down and moderate. So even when we ease the measures on 29th of March, you notice many people out in the open, they're still wearing their masks, they still try to avoid crowded places. So all this helps. But it's a combination of factors. It's very hard to isolate which are the main factors. But as I mentioned earlier, there's always risk down the road. When we ease up further and given time, immunity and protection will wane, new waves will start. But there's no reason to believe that the new wave, if driven by Omicron, will be bigger than the previous wave, because it can't be, because our resilience is stronger. Waning of protection doesn't happen overnight like a cliff. It happens slowly. So it will drive out some cases, but not to the extent of what we have seen in the last few months.
I should just add that one very important factor which Min Ong touched on is the cooperation and support of many Singaporeans and the trust in the system that they have been able to comply with the SMMs that were put in place. And by working together, a heightened sense of alert and awareness of the risk of Omicron, as well as the need for public health practices. I think these are many factors that have contributed to our ability to control and manage the infection, the transmission. But at the same time, we mustn't be complacent because there's always the risk of new waves coming on. New variants may emerge from time to time, and there are still ongoing waves in different parts of the world. So we cannot afford to be complacent. We must continue to remain vigilant, even as we continue to ease up our measures. And in the weeks to come, we can expect that the number of cases may increase because of a greater easing this time round, and therefore we also have to remain vigilant, continue to monitor the situation and be prepared to adjust our measures from time to time. So once again, thank you very much for being with us at this press conference, and this is the last question. Thank you very much.